Did you know that 58% of Australian females over the age of 15 already have one chronic health condition? And by 65, that's 87%. This is the result of something called the gender health gap, which is a $1 trillion problem that I have created the solution for. It's called Ovum AI, the first personal AI health assistant for women. Hi, I'm Mariella and I am CEO and founder of Ovum AI, a tool that is going to revolutionise how women experience healthcare. I was a young female doctor working in regional, remote and urban parts of New South Wales and Victoria in primary care and hospital settings. And I realised that fundamentally, women were completely disempowered with their healthcare, regardless of socioeconomic status. And this is due to three main things. Firstly was fear of the healthcare system. This is due to decades of being dismissed, marginalised and often misdiagnosed, meaning women were often going to Dr. Google, TikTok or family and friends to source healthcare information rather than healthcare providers. Second of all, women were struggling to navigate the siloed and fragmented approach to our healthcare system, which finally the Australian government has recognised as a problem and invested $330 million into making a lifespan approach to women's healthcare. The problem is we still have long diagnostic times, with it taking 5 years on average for any Australian woman to be diagnosed with a general health condition. And for something more complex, like endometriosis, that's 12 years. And thirdly, women were receiving treatments and diagnostics that were not reflective of a woman's physiology. And this is due to decades of women being excluded from clinical trials due to reproductive burden. But now, with the revolution of AI, we're seeing an exacerbation of this, with these gendered data sets being used to train machine learning models, and therefore producing 85% of erroneous outcomes for women due to gender bias. So it's really important that we start creating our own women-specific AI datasets. So what is the solution to these three problems? The solution is Ovum, the first AI health assistant for women that empowers women with their healthcare by making it easy to access health information, integrate all of their health information in one place, and create the first proprietary women's health dataset that we can feed back into industry.
So when we first met Ariella, we were so inspired with her vision to fix systemic issues and really help women wherever they are on their health journey. So inspired that not only are we designing and building it, but we also invested. We're super excited to put this into the hands of real users and start to see the value it brings to their lives in what we hope is a world first.
You can speak to Ovum like a best friend or like a doctor. Ask questions, report symptoms, and get evidence-based and easy to understand health information that you can trust. You can integrate all of your health reports in one place so they're easy to access and centralised. You can even integrate your Apple Health data and speak to Ovum about your health reports as long as you've discussed them with your doctor. Through these conversations, Ovum will create longitudinal health summaries that you can share with your healthcare provider or anonymously with research institutions that are affiliated with Ovum. And that way, we begin to close the gender health gap. We are at the exciting stage of trialling the first version of Ovum with 300 women throughout Australia, so we can begin to get real women's feedback about how Ovum is impacting their lives, but also how we can make Ovum better.
Around 22 years of age, I was prescribed the pill as a way to level out the emotional shift, which resulted in me getting fibrocystic breasts and prolactinoma. It took years to find some semblance of control over my health. Imagine how this experience could have been entirely transformed if I had an app right at my fingertips that knew me, my health history, and my needs. Ovum AI is revolutionary in its potential to change women's lives for the better and can give us accurate and unbiased information, the validation we deserve, and enable us to learn more about our bodies.
Hi Tegan, do you want to tell me a bit about your experiences and how Ovum could help you and on your health journey?
Sure. So over the past 8 years, I would say I've seen numerous doctors who always had dismissed my pain and told me that everything was just due to anxiety and that nothing was clinically wrong. It was only really due to my nursing background that I started on that and my pure determination that I decided to advocate for myself, and I ended up actually seeing an endometriosis specialist who finally diagnosed me, which was very, I felt really good about that. And every time I saw another doctor, I had to retell the story and relive the trauma of being consistently dismissed and misdiagnosed. And I just think if I had Ovum 8 years ago, I would have all that information in one place, and I could then just go and share that with my doctor instead of having to retell all the years of my lived pain and all my investigations and all that suffering, which would have been so much easier.
Yeah, well, thank you for sharing that with us. We fundamentally want this to be an app for every woman, everywhere. But we need your help. We're asking for $20,000 to help develop the second version of Ovum so it's ready for market by 2025. We're also running clinical trials with various hospitals throughout Australia, and we need this second version to be ready. We're asking for your support to help revolutionise women's healthcare. So pledge your donation today and be a part of transforming how women experience healthcare. Thank you.